So today we'll be talking about post-traumatic stress disorder, otherwise known as PTSD. And this is a disorder that has a series of symptoms that we believe comes about because of experiencing a traumatic event. It doesn't have to be exactly experiencing it. It can be a direct or indirect threat of harm to someone or someone they love, or they could witness an event like that. And those could all be classified as a trauma that could cause this disorder. This disorder has a variety of symptoms that are fairly distinct that we understand. One is this idea of a flashback. And a flashback is the way I've heard it described before from people who have this disorder. It's like a short movie that plays back. So it's like the trauma is re-experienced. So the person kind of checks out a little bit. There's an unreal piece to it. And then they relive all or part of that traumatic event, and then they come back. It's a frightening experience. There's also nightmares, which of course are frightening. These happen when people are asleep. Sometimes the nightmares are different nightmares, but all kind of about the trauma, and sometimes they're the same nightmare over and over. There's also intrusive thoughts, and again, most of the time, they're related in some way to the trauma. So if the trauma were a house fire, the intrusive thought could be a person worrying that their house will catch fire. So this does lead to distress, PTSD. These symptoms are certainly disturbing, and we have connected them, at least in this disorder, we've connected them pretty clearly to this traumatic event.
So can anyone get post-traumatic stress disorder, like at any age, or?
This is a great question, yes. PTSD can affect anybody over the age of 1. Technically, if you're looking at it for the technical facts behind the diagnosis. So 1 to however old somebody may live, they can experience PTSD. I've seen this disorder in children. I've seen this disorder in people in their 60s, 70s, and 80s.
Okay, so is there any specific job or people put in in harm's way are more likely to get post-traumatic stress?
Yes, there are certain careers that we see more associated with this illness than others. Probably the one that comes to mind first would be combat veterans. Someone that has experienced combat directly, someone that's been in a combat area, they have a higher likelihood of post-traumatic stress. In a similar vein, first responders have a higher chance of PTSD. Firefighters, paramedics, police officers, people that see horrific things, people that witness traumatic events. Another group that tends to have this disorder more often is people that have been the victims of physical or sexual abuse when they're children.
Okay, so are men then, I guess, more likely to get post-traumatic stress than women?
Based on what I just said, it might seem that way, but actually in the case of this disorder, women are more likely to get it. And we believe this is because women are exposed to more traumas.
In what way?
Well, we believe that women are more likely to be exposed to physical and sexual violence when they're children.
Oh, sure. Yeah, that makes sense. So are there effective treatments, and can someone be cured of this? Is it something that they're going to have their whole life?
Great questions. There are effective treatments for post-traumatic stress disorder. It does respond in many cases relatively well to treatment. There's research out there that suggests that after a traumatic event that you believe to be linked to PTSD, get the treatment in as quickly as possible, and that leads to a better outcome. In terms of whether it can ever be cured, there are some cases, many cases, where the symptoms will go away fully after treatment. There are other cases, and we're not sure why, where the symptoms hang on for a long time, sometimes for life. This is an illness where we know that getting treatment involved early can be helpful, so it makes sense to try to get treated as early as possible after a traumatic event.
So why do some people seem to get post-traumatic stress and then some other people don't?
We're not exactly sure, but what's surprising for a lot of people with this disorder is you can have the same traumatic event occur and you get a lot of different responses. Some people seem okay, they don't really have symptoms, and other people get PTSD and they have severe symptoms. We believe there are a lot of factors that can predispose somebody to make them more vulnerable to developing this disorder. Lack of social support, exposure to environmental stressors, drug and alcohol abuse, the presence of other disorders, genetics. There's a lot of factors we believe could make somebody more vulnerable. But the short answer is we really don't know. For any given person, any given trauma could lead to PTSD. We're never sure until it happens.
It sounds like this has been researched and looked at for a long time. Is there a lot of research on post-traumatic stress if I wanted to look up more information up about it?
Yes, yeah. This disorder has a lot of research studies that have been done about it, and the issue, a topic of trauma in general, has been studied and researched. So it's not just PTSD, the actual disorder, but trauma and how trauma can lead to other mental health disorders and how we believe it contributes to depression, anxiety, substance use, obsessive compulsive disorder. So really the story behind PTSD isn't just the disorder itself, it's the role that trauma plays in developing that disorder and others.